Welcome to the Now What podcast, a podcast focused on young adults, epilepsy, and the problems they face. I'm Sophie, your host and an advisor to the Cameron Boyce Foundation. TCBF honors the legacy of our best friend Cameron by aiming to cure epilepsy through funding research, education, and awareness campaigns while still supporting causes that were important to Cameron. We are incredibly excited about the conversations we are having each week, and it wouldn't be possible without our sponsor, UCB. So thank you, UCB. In this episode, we are covering SUDEP, sudden unexpected death in epilepsy. This is a bit of a heavier episode, so a warning for that, but important nonetheless. If you are a regular listener of ours, you know I'm usually with my partner in crime, Karin Barr. Karin could not make it today, but given the topic of this episode, I thought it made sense to be joined by another one of Cameron's friends. So with that being said, let's meet our guest for this week. First up, we have screenwriter and producer Tim Ogeltree. Tim is living with epilepsy. He's a very dear friend of mine and was a friend of Cameron's as well. When Cameron passed away, that was the first time Tim, who had epilepsy and had for many years, had ever heard of SUDEP, which I think is an experience that so many of our listeners share. So while Tim lost a friend very close to him, I know so many of you listening also felt that loss personally, and then were dealing with the repercussions of hearing of SUDEP for the first time. And so I'm really excited for him to kind of share his perspective and what that experience was like for him discovering SUDEP. Also joining us today is Dr. Dan Friedman, the director of the Division of Epilepsy at NYU Langone Health, and is a professor in the Department of Neurology at NYU Grossman School of Medicine. Thank you so much for joining us today. Let's get right into it. Hi, Dan and Tim. Thank you guys so much for doing this. I super appreciate it. I know this might be like a slightly heavier episode. I'm really grateful to have you both. I'm going to start us off kind of going towards Dan, and just can you give us like the basics of SUDEP? What is SUDEP? How common is it?
So SUDEP, which stands for sudden unexpected death in epilepsy, is the occurrence of a death in a person, epilepsy, who is in otherwise good health. And often that person is found, usually in bed by family in the morning, likely having died in the middle of the night. It's likely not one thing, but just a catch-all term for this phenomenon. And we know that people with epilepsy have a 26 times higher rate of sudden death than the general population. And when you look at people with epilepsy, SUDEP is unfortunately not that rare. It occurs at about 1 per 1,000 patients per year with epilepsy. So in the United States, that translates into about 3,000 people with epilepsy who die of SUDEP. And it looks like that those rates are pretty similar in kids, adults, and older adults. And the majority of the time where the death is unfortunately witnessed by family or in a hospital, those deaths follow a seizure, and it's specifically a tonic-clonic seizure or a grand mal seizure, but not always. So we think that some of these deaths are due to the direct consequence of seizures, where the seizure themselves may cause people to stop breathing, or their heart to go into arrhythmia, or if they're face down in the bed and they can't regain consciousness after a seizure. They may have asphyxia. They may not be able to breathe. There are some deaths that are witnessed where people can see them and people are being monitored in the hospital or seen by family. And those deaths occur suddenly, but are not related to seizure. Those seem to be a minority of the deaths, but they can happen as well. And there are likely lots of different or several different causes of SUDEP. that happen. But we do know that SUDEP is more common the more severe the epilepsy is. That means the more frequent that people are having tonic-clonic seizures, and the worse their epilepsy control is. For people, for instance, in my practice, who many of them have what we call drug-resistant epilepsy, they continue to have seizures despite multiple medications. Their rates of SUDEP are closer to 2 to 4 per thousand patients per year. So up to 1 out of every 250 patients in a standard epilepsy practice where we see these complicated patients may die of SUDEP.
Thank you. That's a fantastic overview. Super helpful. How about SUDEP underreporting? How common is that? And how do you think that maybe affects like research dollars and information that we have about SUDEP, since it's fairly unknown, as you mentioned?
Yeah, it's a big problem. In many places, when somebody dies suddenly outside of the hospital, those deaths are often, but not always, investigated by a medical examiner or coroner. A medical examiner is somebody who's trained as a pathologist or other medical professional, and a coroner is generally somebody who doesn't have medical training, but they're ultimately in charge of certifying the death. And we know that in those systems, when we look at it closely and re-review the records of people with epilepsy who die, about somewhere between a third to a quarter of SUDEP deaths are missed by medical examiners. And those are just people who go on to have a forensic examination. In some parts of the country, medical examiners and coroners don't really focus on natural causes of death and are more interested in investigating things like homicides and suicides and other sort of violent, unnatural deaths. So we do think that SUDEP is underreported, and it's undercounted too, because the way that death statistics are kept is, the person investigating the death, the coroner or the medical examiner, fills out a death certificate based on what they think the cause of death is. All that information is then fed to the state and then the National Vital Statistics Agency. That's where we know how many people die of cancer, how many people die of heart disease in the US, et cetera. And what the people in these vital statistics agencies is, they take whatever's written and try to shoehorn it into the best possible diagnostic code. And there is no diagnostic code for SUDEP. So even if the coroner or medical examiner writes SUDEP on the death certificate, that death is counted as epilepsy or seizure. And it doesn't make the distinction between somebody who died of epilepsy because they drowned, or because they had SUDEP, or because they had a prolonged seizure that caused them to go into the hospital. And so we don't have ways to track SUDEP at a sort of national level using these vital statistics yet. And there is work on creating a diagnostic code, what's called an ICD code for SUDEP, but that's a long, complicated process that involves the World Health Association.
Right. And that, correct me if I'm wrong, is important for the fact of research and information to raise money. It's important to know how many people are being affected by something, correct?
Yeah, I mean, it's important to understand the public health impact of a disease.
Yeah.
But also it's important to understand in public health interventions. So imagine I wanted to do an awareness campaign or like you guys are doing around SUDEP, and I wanted to see if it worked, if it made a difference in the rates of of SUDEP in a community, in a state or a country or something like that, really the only way I could tell is if I track these statistics before and after.
That makes sense. Yeah, I mean, it's a big issue for sure if that's underreported and under diagnosed. I quickly kind of want to take it to Tim. That was a lot of information to sort of take in and process, as I've heard most all of that before, having started doing this. But so many of the people listening, their first encounter with SUDEP was finding out that Cameron passed away. And Tim, who was our friend, had a similar experience. And Tim, I would love to just kind of hear first, like, your overview of your epilepsy journey, just to kind of give listeners an understanding of like how long you've had epilepsy, medications, that kind of stuff.
Sure. Um, well, I had my first seizure when I was 19. I was just in my dorm in college watching Lost on my on my laptop, and I woke up staring at, EMTs who were like, "Are you good? You okay? You know where you are?" All that stuff. And it's weird. It's a very weird thing to just be like, I'm good, but like clearly something happened. You got this fog, this weird state that you're in, and sorry, it's weird to talk about. But after that happened, I kind of thought back to high school, and I would be in class, and I would just get this weird thing I thought was a daydream. I would kind of like space out and just thought nothing of it because I was always tired in high school. And I was like, sure, I'm just taking a nap. But thinking back, I was like, oh, that was probably a sign, And fortunately, mine have been spaced out. Anytime I've had a seizure, there's usually like at least a year gap. So my meds have been really good to me. And it's relatively controlled as long as I get sleep, ironically, and just kind of take my meds and stay hydrated and don't, go on some crazy fasts that take my nutrition levels to, too low.
Yeah.
But
I mean, you've been good about understanding and learning your triggers over the years for sure.
yeah,
But then sometimes things have surprised you as your friend. I know that's happened to us before where we're like,
yeah,
what?
and like, and everybody, like you guys have been so good about it, just being aware of it, especially after Cam. And my family's always been good. My wife's really good. Just being aware and trying to keep my driving to a minimum and making sure I get that sleep, that 8 hours that I aim for. So it's controlled, but it's still weird because it's always kind of back there as like a possibility.
Right. Of course. So, Tim, losing Cameron was the first time you'd ever heard about SUDEP. And obviously, losing a friend is hard, but then also losing a friend is something that you had no idea could absolutely affect you as well. How did this kind of change your relationship to your epilepsy and how you looked at your own epilepsy?
Well, it definitely shook it up. When I found out, I had literally that morning, gotten to Oklahoma City to shoot a movie. And so I was going to be there shooting this for like 6+ weeks. And, away from family, had some friends there, and they've known about it for a while and have actually seen it happen. So they're very aware and very, like, as soon as it happened, they were like, all right, got to keep an extra eye on Tim. But, shooting, my mind immediately went to, this is like, we're going to be shooting at night. I'm going to have to leave set so that I can go get sleep and not, have something like this happen. And since then, it is kind of like this sounds like sad, but every night when I'm going to sleep, I'm like, this, I don't know.
Yeah.
It's a weird feeling to know that you have something that can kind of just take you away. And, I'm a man of faith, so it's not like I'm not worried about death so much as I am it affecting the people around me,
Well,
because
you
I
saw,
saw how it affected you guys. And I mean, I got the call from my brother, Troy, and he was like outside of y'all's place, and he wasn't like directly, seeing everything happen, but he saw you guys and he had talked to you guys, and, so I still got it wasn't a direct from the source, but it was, next to, and
yeah.
just seeing how heavy that is, I I can't imagine like my wife Brittany, waking up to see that. So it's not
I
so
know.
much about um how it affects me, because if I don't wake up, I don't wake up. But I don't want anyone to have to, go through something like that. So it's changed how, like, I was already aware, and I tried hard to keep my life, living my life in a way that wouldn't put me at more risk than I was naturally in. But after this, I was like, it was like a double down, like really just strap in, and had to change some things and make sure, like, on that movie, they were very like, go home, it's, you're not going
Yeah.
to be here till 2 a.m. Like, go home, get some sleep. We'll see you in the morning. Like, there's no, you know, they took care of me.
That's good.
And that's like the biggest blessing I think I've had, is just people around me who care enough to hold me accountable, sort of, and, you know, just be
Well,
aware of everything going on.
you've always been good about that. Even before Cameron, I have used our relationship sometimes as an example when I talk to people about friends and supporting friends with epilepsy, because we were always good. Like, if we would go out, you didn't mind if I checked in and was like, "Did you take your meds? Like, do you need anything?" And like those kinds of things. You were really communicative with us always, always have been. And I feel like that was helpful for everybody involved. How has this affected, because you sort of mentioned like worrying about the other people, which is so sweet, and also just in general, thanks for sharing all of this. How has it kind of affected your communication with your family? Because I know, like, obviously, Tim's two siblings were also very close with Cameron. The whole family was, and I know your mom also had epilepsy. How has this kind of affected how much that you've had to communicate with them, for better or worse?
um, it's they're really good about not making it a thing, any more of a thing than it is. My dad is, well, now he's retired, but he was a doctor. Um, Retired a couple of years ago, but he's still got the doctor mind, and he checks in. You getting sleep? You doing this, doing that, and especially when it comes to driving, because I had already, I'd been in LA for like 2 years, and I got up to go to work after sleeping maybe like 4 hours, and I had to take I-10 to work in Santa Monica. So it was like a few miles on the highway. I was getting onto the highway, and I woke up in my car, like on the side of the road, with a tow truck in front of me, and like EMT knocking on the window. And it, again, it takes a while for you to kind of catch up to reality. And I was like, once I realized what the heck happened, I was like, oh, I should have died. Like, that is like the timing on that is like miraculous. I was merging, so my foot was on the brake as opposed to the gas, where I would have. And I definitely hit something, because like the side of my truck was all dented in, and it could have been like super, super bad. And so after that, my dad was like very wary of me driving. And after Cam, it really, like, even though, Cam's wasn't related to driving, it was just another reminder that this can take me at any second. So, long road trips aren't really in the cards for me unless it's absolutely necessary.
I'm glad that they haven't, like, I don't wanna say overreacted, but put more of a burden of worry on you in that, because I think that's such a hard thing to navigate. Because there's nothing you can really do. I mean, we'll get to sort of hopefully the conversations we can do, but I think that's so hard. People are worried about scaring the crap out of everyone around them with this information. And then also then you worry burden the epilepsy person to like calm everyone's fears at the same time. And that's hard itself. So I'm glad to hear that, like, even though, I love your family, I'm so glad that, like, you guys have managed to kind of get through that, like, super scary moment for all of you with losing Cameron and being like, not just directing that onto you and like unwarranted fear all the time. I
Yeah,
hope
I
that there's something
definitely,
taken from that.
they haven't made me the focus of, of worry day in, day out. I'm sure it's there, but like, I try to do my best to like make them feel comfortable, like I'm living my life in a way that is safe for me. So yeah,
So, learning about SUDEP, did you speak to your neurologist after,
yeah.
like hearing about it? How did that kind of conversation go for you?
Well, it was kind of like he knew about it.
Yeah.
I kind of brought it up I went as soon as I got back from Oklahoma. I set up an appointment.
Hmm.
I was like, hi, so this thing happened, not to me, obviously, but
Right. To my friend.
what
Yeah.
do I need to be aware of something? Do I need to change something? Are my meds good? All that stuff. Like, what do you know about this? And because it is like, I mean, epilepsy alone is kind of this mysterious, like,
Entity.
no, yeah, nobody knows like the root cause, and it's sort of just
Mhm.
like a deal with it kind of thing. So SUDEP was even less of like a focus for like he had never mentioned it before, and he was really like, I honestly can't say much to make you feel better other than it is, relatively rare, but it's still a possibility. So it was kind of a, like, I more have made him aware that I knew about it. And
Yeah.
after that, it was like, okay, well, always take your meds before dinner, drink a lot of water, like, be hydrated, don't, don't get blackout drunk, like, don't, uh,
I am kind of curious, Dan, how for you, like, what do you recommend people ask about SUDEP? And also, why are doctors so hesitant to talk about it? Although I think it's probably just the fear of scaring their patients.
Well, I think, a couple of things, but Tim, just a question for you. Were you seeing an epilepsy specialist or just a general neurologist?
general neurologist.
Yeah, we looked into this about 8, 9 years ago. We actually did a pretty big survey of neurologists, and we found that only about a third of neurologists talk to their epilepsy patients about SUDEP most or all the time. Some only talked, some of them talk to them sometimes, often in the setting of like better take your medicine or else kind of conversation. And some didn't talk about it at all. And a couple of things, that we found that drove the conversation, that the people who said they did it all the time or most of the time, they were the people that knew more about it. So either epilepsy specialists or people who had a SUDEP in their practice.
Mm.
So I bet you bringing the conversation, the topic up with your neurologist, even though it wasn't his patient, probably influenced him in future interactions with patients. but probably the reticence was he didn't know enough about it. He didn't know enough how to protect yourself, what kind of measures you could take to reduce your risk, and probably don't want to worry you. And I think that's the biggest fear, especially in neurologists who treat adult patients. I think it's a little bit different with kids, but especially when I talk to neurologists who treat mostly adults, they're worried that about upsetting the patient, disrupting the doctor-patient relationship, alienating the patient, making them anxious. And certainly there are patients who, when you ask them, do you want to know? They'll say, no, I'd rather not know. But that's the minority of patients. Mm-hmm. I think, as epilepsy specialists and even as neurologists, we recommend that every patient be told about their risks from their epilepsy, and that includes SUDEP, but also includes other things that you mentioned, right? The accidents, right? I bet your neurologist told you about driving risk in the beginning when you had your first seizure. That's pretty common, and it's sort of common sense safety stuff. Don't climb on ladders, don't go skydiving, don't swim in the ocean. But this is, SUDEP is part of that whole conversation, right? Why are we telling you should take a medicine every day for the next X number of years, right? To prevent the consequence of uncontrolled seizures, mm-hmm. which include accidents, drownings, fractures, and SUDEP. So I think it's a challenge, but I think there are ways that you could incorporate this into a discussion that informs the patient and helps them take specific actions that will hopefully have them be able to manage their epilepsy better. I don't know, Tim, what did you do differently before and after Cameron's death? Once you knew about SUDEP, how did you change the way you lived your life?
When it came to sleeping, I started taking melatonin just to make sure I stayed asleep and got, really rock solid shut-eye. I got an Apple Watch and signed up for this service that it basically is a motion detector for your watch. And so you can set a certain threshold, and if it detects an extended period of rapid movement, it alerts. You can set contacts, and it'll alert mm-hmm. people. I had one that started out, and it was kind of people get the text, and they were very cryptic. Wouldn't understand. It was there was an incident at blah blah blah. So I did move to one called Seize Alarm, but it's same concept, and it's helpful mostly because it's kind of a peace of mind thing. And so I would wear it when I was going to bed asleep, especially if I was alone. Now that I'm married, I have my own Seize Alarm sitting right there.
But I remember you getting that and your family being so relieved at the time mm-hmm. when you got, just even if it's not perfect, it is a peace of mind kind of thing.
I've been fortunate that it's never been necessary, because of an event, but there were funny times where I was shaking a bag of salad to get the dressing all in there, and it went off, and I didn't really know. I just started getting texts that were "You okay? You good?" And I was "Yes." Oh man, didn't even think about that. Yeah. Or a shaky driving or steering wheel when I was in Oklahoma.
Imperfect.
Funny stuff like that. It's proof that it works. And it definitely, everyone who I put as a contact was yes, please, I don't care something happens, like if I get a false alarm, doesn't matter. Just like keep on keeping on with that service.
I'll also speak to something that's not so much what you did after Cameron passed, but I think for people around you, even peripherally, uh, Tim had a seizure about almost a year to the day after Cameron passed away, and
Mhm.
we were away with our friends, and we were all together. And a couple friends who didn't maybe know us as well, when Tim had a seizure, I'd never seen one before. And they all came up to us and they were like, we were so much more prepared because, we were looking at the seizure first aid and stuff. So I do think the SUDEP conversation has obviously affected you, but I think it also, if it makes it, the more we're visible about epilepsy
Yeah.
and SUDEP as a possibility, the more people are informed on that too. Can affect their response to it. Because I just remember being very taken by the fact that like everybody handled that very well, even people who didn't know you that well. Like your family was always very good about your seizures and some of our closer friends, but that was something that I think maybe shifted partially because of this, of like, and even more encouraged us to talk about it and to talk about
Hmm.
how we can support the people in our lives with epilepsy. But
Yeah.
yeah.
I also I got texts and calls from the most random people who, were like extended friends through you guys or Cameron, um, who like I didn't even know knew that I had
Mm.
epilepsy. And they're like, "Are you doing well? Are you okay?" Like, just like checking up on me. And that was really cool. And that's how you got, the good ones around
Good
you.
people. And
Yeah.
also, like, that's again just a testament to you with being open about it too, because that's really big, and a lot of people aren't. I sort of based on that. So I think you've kind of answered the question of like, obviously, doctors are hesitant because there's only so much we can do to change our behaviors.
Well, I mean, I think that, but that's, but I think, there are things we can do. And I think that, and, not everybody may have those options, but I think, arming somebody with information is, empowering, right? Um, if you, like, for instance, if somebody had a conversation about your seizure triggers or seizure alerting devices, in the context of what you could do to lower your risk, um, you know, uh, probably you might have done things differently even before Cameron's death.
Mhm.
And it's obviously different when it's something abstract versus something, someone close to you, in terms of how it affects your behavior. Um, but still, I think having those tools, and it isn't nihilistic, So the major risk factors for SUDEP are, having ongoing seizures, especially tonic-clonic seizures or convulsive seizures, having nighttime seizures, uh, being alone at night, living alone, not sharing a bedroom with someone, and some of these things we can change. We have many treatments for seizures. So if your current treatments aren't fully controlling seizures, and especially if they're not fully controlling tonic-clonic seizures, uh, you can try other medicines. Go see an epilepsy specialist to talk about other treatments, including, there's brain surgery for some people to treat their epilepsy. There are diet therapies to treat epilepsy. And we know that even a partial reduction in the frequency of seizures in people with active epilepsy can lower SUDEP risk. And so certainly on the therapy end, and then sometimes people have seizures that are well controlled, but have, what we call breakthrough seizures that happen because they forgot their medicines, or that they stayed up late or had a little bit too much to drink. And thinking about, lifestyle strategies. How do we, help people remember to take their medicines? How do we encourage people to get good rest? what are the appropriate limits on the amount to drink, those sorts of things can also reduce the risk of SUDEP.
Yeah.
And then obviously not everybody can find a bed partner at will.
Right.
But those things like watches, like the wearable devices, and there's apps for smartwatches, there's specialty watches that are available, and other tools. They could sort of bridge that gap of nighttime supervision, yet somebody is sleeping alone. The reason why we think, at least, that having somebody there at night protects people from SUDEP is because somebody could deliver seizure first aid. They can roll you over on your side if you're down on your face. We know that actually that even touching people, shaking them, shortens the duration of seizures and actually shortens the low oxygen that can be or blunts the low oxygen that can be seen after seizures.
I didn't know that, and I've done so many of these conversations, and I didn't know that.
And these are studies done in the hospital. We don't know if it is true in the real world.
Sure. But still, I know seizure first aid, which does involve touching the person, but I just didn't even, wow.
Yeah. And so even those kinds of maneuvers help. And, if somebody can get to you in a few minutes, that may be life-saving.
Can make a big difference. Yeah. So I think along the lines of like how one would go about having this conversation with their neurologist or epileptologist, would you sort of recommend just asking about, like, with their type of epilepsy, what the risks are, maybe some of these devices that are options, and sort of going off that for like questions to ask your doctor?
Yeah. I mean, I think when you're new to any diagnosis, right, there's a lot to take in. Tim, it sounds like you have other family members with epilepsy.
Yeah, my mom, she had a seizure in college, actually, like the exact same age, but she only had one. She went on Dilantin, which I don't know if that's still like a common medication, but she was on Dilantin until like 5 years ago, maybe. Like, she literally just took it, never had another one, and then her doctor was kind of like, let's try to phase it out and see how it goes, and she's been fine. So yeah, but that's, I think she's the only family member.
But at least you or your family knew what it was, right? Imagine coming in there not knowing anything, and now I tell you have this condition that you don't know anything about, and now I'm speaking, telling you all these, facts and figures and things to do and not do and all this stuff. And at some point, that's just too much information, right?
Yeah.
So
maybe a step at a time, appointment at a time.
Or it's a conversation that you have to revisit, right?
Yeah.
So, and revisit in different ways. So my approach with somebody who I make a new diagnosis, like I said before, I sort of put it in the context of safety and rationale. Why are we taking medications? Why do we need to start a medicine? Why do you have to not drive for 3 to 6 months, wherever, depending on the state you're at, because we want to keep you safe. And then the next steps, in subsequent visits, then, depends on how people are doing. Then we could say, we explore each of those things in turn, right? Let's say they've, are going off to college is a common situation. That's a life transition that carries its own risk, and special risk. And that's another opportunity to come back and have that conversation about, seizure management and bring up SUDEP again.
Yeah, especially when there's a lot of lifestyle triggers that come up with college, and then you're also balancing
way less sleep.
And and I don't want to minimize. I mean, you guys sound, you're doing a great job, and um, and and Tim, it sounds like you have a really supportive group of friends, but a lot of people, are stigmatized by their epilepsy,
Completely.
and and don't want to tell their friends, or don't want to tell their college roommate, don't and and that can be detrimental to their safety too. So,
Yeah.
Yeah.
Which is something, if you're listening to this and you're thinking this might be you, you can also listen to our college episode, because we do talk about some of this and like how to navigate that. And yeah, I mean, it's hard. It's hard. I do always go back to the people in your life want to help you, and they will worry less when they are informed. And I think that is such a big thing, that it can feel hard to bring it up, and you don't want to burden your friends, and you don't want to do all of this with your family. But as the friend and family member, I always worried so much less about Tim when I had an open conversation. And same with Cameron. Like, I don't, my worry decreases when I know we can talk about it casually. And I think that can be a big, just note that I've said this on the podcast before, but I will say it again and again and again. And then obviously stigma is real. So hopefully it's someone you trust that you can talk to. But yeah, on a much more positive, hopefully note, Dan, can you speak to any of like the new advances on the horizon that you might be hopeful for SUDEP prevention? Did we just lose Tim?
all right. So in terms of advances, I think we are trying to understand the what the biology. Lots of data is going to come out soon about identifying other risk factors. Instead of saying you're a person with epilepsy, the average risk is 1 in 1,000 patients per year. I think we're getting to the point where soon we can have individual risk models. So meaning that, you with your characteristics, with your seizures and your lifestyle situation and your MRI or whatever features we want to put in, then we could say, this is your risk. And then more importantly, we could say, well, if we do this, right, if we reduce your seizures by half, this is how it will change your risk. And I think having those tools are going to be important to empower patients and their doctors to have those kinds of conversations, because it's not futile.
Mhm.
It's not mysterious. We know. I think that, there's a big interest in wearable devices, like Tim was talking about, to alert people when somebody is having a convulsive seizure to provide aid. The problem with those is you need to have somebody nearby.
Yeah.
Usually, you can come in within a few minutes to provide that aid. And there definitely have been cases of people where the alert went out, but by the time help arrived, it was too late.
Yeah.
Yeah.
Ideally, it's if you can live with someone, even if you can't share a bedroom. Yeah, someone
Yeah,
that's
or
there. Yeah.
a neighbor or somebody nearby.
Mhm.
But what we really need is closed loop devices, right? Ones that take out the need for somebody to uh, uh, come by, and people are starting to work on those kinds of devices, whether they give a little stimulation, whether it's something mechanical like moving a bed. Those are kinds of ideas that are being explored. How do we keep people who live alone or may not have nearby help safe, and allow them to be independent? And those are important things. I think the most important thing is we also get more effective treatments for epilepsy, right? And so people who are seizure free with either with medication, or with, if they've had successful epilepsy surgery, for instance, their risk of SUDEP is very low, and probably their risk of sudden death is close. Their risk of sudden death and premature mortality is close to that of the general population. So, obviously, not everybody's seizures can be entirely controlled with the tools we have now, but if we have better tools, if we have better therapies, if we have therapies that people take because they're not causing side effects or things like that, I think will also make a big impact.
Totally. There's an obvious link between seizure control, and I think, yeah, if we can make it easier for people living with epilepsy and then also lower SUDEP, that's a great way to do it.
And my sort of comment for the audience is, if you're still having seizures despite your treatment, and especially if you're still having tonic-clonic seizures, you need to explore what you can do to better get better seizure control, whether that is thinking about other options for seizure therapy, like surgery or implanted devices or diet, whether it's going to see an epilepsy specialist at a comprehensive epilepsy center to make sure that your diagnosis is correct, that you know what kind of epilepsy you have, and you're getting the right treatment.
Yeah. I think I cannot imagine how difficult drug-resistant epilepsy is, but I do think it is not reminding, but when patients are informed about SUDEP, it can be another push to keep fighting to try and find a way to control your seizures. And I mean, that is important, and know that there are other options that you can look into, and hopefully your epileptologist can talk to you about that.
Yeah, and even if you can't get all seizures, you can talk about devices or other lifestyle things. I recently had a conversation with a patient who was considering moving out to an apartment by herself, and she was tired of living with roommates. And we had a conversation of why that may be risky in her situation.
Yeah, which I mean, it's so hard to accept your life limitations. And our hope is that the more we have research and the more we can do to make that easier. But yeah, these are things that you have to consider, and hopefully you can sort of find someone that's supportive in your life to help you with it. Um, Thank you guys both for talking about this. I feel this was very informative, and also hopefully a little bit emotionally helpful to people that are feeling afraid of SUDEP and on their own in that fear. Just know you're very much not. Thank you, Tim, for sharing that. Because I do think that is the one thing everyone's like, I didn't know this could happen. Now that I know, I'm terrified. I don't know if it's good that I know, and all of those things. So I'm glad that we can have these conversations. Hopefully, just at the end of the day, make people feel a little bit less alone in the fear and confusion.
Well, whenever I talk to people about my epilepsy, I always want to reaffirm to everyone that even if you have epilepsy, you can live a normal life. Might be a different kind of life, but don't stop living your life, and don't live in fear. Don't let it cripple you in any way that isn't putting you at risk. It's very possible, especially if you're younger and you find out. I met a bunch of younger people who have to deal with it in elementary and middle school, and I can't imagine what that's like, but it's livable. You still have a life to live. Go friggin' have fun to the best of your capability.
Yeah,
Life rocks.
I want to mention too, as we talk about epilepsy and mortality, this is a great note, because I mean, suicide is also a cause of death with epilepsy. And if you do need help, you can call 988 crisis hotline. Listen to our mental health episode too, because I do think that is unfortunately also something that people with epilepsy have to live with, and figuring out how to live their life and know that, like you said, there is a life to be lived. And I hope that sort of reaches people in this as well, for sure. So thank you for that message. That was a perfect little ending. And yeah, I guess I'll sign us off with thank you to our sponsors at UCB for making this conversation possible every week. So thank you guys.